The 4th of July weekend brought thousands of Oklahoma families together for barbecues, and thousands more gathered for large outdoor fireworks shows and concerts. All of this happening as Oklahoma now ranks in the top 10 nationally in new COVID-19 cases per day per capita, with hospitalization numbers their highest since March. Why is this happening now, and how concerned should we be? Rory Taylor reports on the new variants gaining a foothold in Oklahoma.
Toward the beginning of June, Oklahoma began a steady climb in the percent of our COVID tests that were coming back positive. According to the Mayo Clinic, that rate has tripled from just 5% of Oklahoma's tests coming back positive to 15%. But test positivity doesn't tell the whole story.
We're facing relatively low testing rates, which basically means, to me at least as a clinician, that patients are not presenting until they've got symptoms, and therefore a higher percentage of them are positive.
And he's right. There's been no spike in active cases like we saw at the beginning of November or January. Instead, our 7-day rolling average has been gradually climbing again, more like the slow curve upward from last June.
June 18th for you can see how progression has occurred in what we think is likely heavy involvement of Delta variant here. So you can see Northeast Oklahoma really continues to be the site that's, I'm going to say, least green.
That northeast corner of the state is believed to be being affected by high rates of spread in our neighboring states like Arkansas and Missouri. Dr. Sam Ratterman works at the Grove Hospital in the corner of the state and spoke on what they're seeing in that hot spot.
The overall symptoms and case trajectory of all of our COVID patients are a lot different than what we saw back in February. People are getting hypoxic, or their oxygen levels seem to be dropping a little bit quicker. They're coming in or presenting initially with more mundane symptoms, sore throat, headache, just not feeling well. But the ones that get sick tend to progress much quicker into the respiratory issues.
Ratterman says that the vaccination rate in Delaware County, around 28%, is largely representative of older populations. And with much of the population unvaccinated, the Delta variant has been able to spread.
In this Northeast region, we have a high percentage of people who do not have vaccination at all. And I think that's really what's fueling this Delta variant coming in. It really seems to be preying on those unvaccinated people. As we get more and more cases, then that spills over to the other people who maybe were vaccinated.
So what is the Delta variant? Dr. Dale Bratzler is OU's chief COVID officer and has released 2 reports in the last week on the Delta mutation of the COVID-19 virus.
The Delta variant has been found in more than 80 countries now, and in the United States, it now today represents more than 50% of all of the new cases that are diagnosed in the United States. It is more contagious. It seems to be very effective. The mutations have made it very effective at attaching to human receptor cells, and so it spreads easily from person to person.
Dr. Bratzler cautions that the Delta strain is much more easily passed on by brief, close contact. Some preliminary data has suggested it might also be more aggressive in its illness, but that is not yet confirmed by studies or consensus.
It makes you at least as sick as previous strains of the virus. We just don't know yet whether people are getting sicker, more likely to be hospitalized with the Delta variant.
Symptoms do seem to vary in cases with the Delta variant. Runny noses and headaches are more common, and fevers are less frequent in less severe cases.
2 weeks ago, we put out a health alert network to all facilities, labs, hospitals, asking them to send not only positives that might meet a certain criteria that might make them more likely to be a variant, but any positive lab result that they have to the state health department for sequencing.
The sequencing process takes 4 to 5 days to complete between gathering samples and verifying reports, which is actually pretty fast compared to the CDC's data that runs on average 2 weeks behind.
Of all the variants of concern that we've seen here in Oklahoma, about 17% now is the Delta variant. And that is consistent to kind of what they're seeing in Missouri and Arkansas.
But with a higher rate of contagion, that number is expected to multiply as it did in the United Kingdom and India, unless it is stopped by preventative measures, like vaccines.
The biggest risk for getting infected with the Delta variant is to not be vaccinated. That clearly is the biggest risk. But we know the Pfizer and Moderna vaccines are effective against the Delta variant.
Currently, Oklahoma's vaccination rate seems to be leveling off at 45% of the state having received one dose and 38% of the state being fully vaccinated.
There are some counties that are likely lower than other counties when it comes to vaccination. And those counties are probably at higher risk for having transmission due to other variants or due to COVID in general.
A concern that is backed by an increase in hospitalization rate of COVID patients. More than a fourth of people who have a positive COVID-19 test in the last 14 days are getting admitted.
The biggest concern there is in the two older categories where their admission rates are approaching 40 to 50% in the 65 and up group. And I did double check with a few facilities, and 100% of those admissions that were reported to me were unvaccinated.
Rory Taylor, The Oklahoma News Report.